Hi everyone, welcome back to the Mental Health series with the Equality Justice Alliance and Butterfly. And today we're going to be talking about the main issues that LGBT people face with regards to mental health. So, as LGBT persons, and for definition, we're going to have the text of what each letter of the acronym means: lesbian, gay, bisexual, transgender, intersex, and queer. So it usually is much more challenging navigating life for several reasons, such as family and friends, not accepting, finding it hard, or to even explain to them life and why you have acknowledged your gender identity. Finding a partner, fear of safety in public, and being called derogatory names by persons, strangers, whoever it may be. All of this can adversely affect the ways that these individuals can go about their day-to-day lives. This especially affects the mental capacity in many ways. Some ways more harmful than others, or that others cannot even process themselves to understand that they're having challenges with mental disorders or mental illnesses. In Barbados and the Eastern Caribbean, there are no persons, if they aren't competently trained in mental health care, especially with regards to the LGBT community, which is very unfortunate. There is, however, a universal tool in psychiatry called the DSM. The DSM was created and published by the American Psychiatry Association. So a bit of a background on the DSM. The DSM's name in totality is called the Diagnostic and Statistical Manual of Mental Health Disorders. The DSM-1 was created in 1952, created and published in 1952. It has been followed by several editions, with the latest edition in 2013. In 1974, being gay was removed from the DSM-2, and this was due to the fact that gay activists and a gay psychiatrist were protesting its classification, which made their lives pretty much impossible. It impeded the access to employment, access to insurance, access to healthcare, housing, and among other things. Throughout history, being a part of the LGBT umbrella was diagnosed as a mental illness. Then and now, due to the lack of knowledge and not enough public dissemination of information, a high percentage of the general public believes that being yourself, LGBTIQ identified, are mental illnesses. The DSM tool undergoes revisions and updates, and being LGBTI is no longer classified a mental illness. As of 2019, the last part of the LGBT acronym, the transgender part, was declassified in 2019. Therefore, being transgender is no longer considered a mental illness. However, due to some anecdotal beliefs, people often think being LGBTI is still a mental illness. However, the DSM tool is rarely used in the current context of psychiatry, psychology, or mental health with the regard to the healthcare providers. It is oftentimes not used because some persons have their own personal beliefs and criticisms of the DSM tool. The DSM is standardized, has been used to standardize care and treatment for mental illness and mental disorders. However, some persons refuse to use it because of their own personal biases. Some of them have cultural appropriation problems with the tool, and some persons just generally have a disregard for continuing with their education. Some people are stuck in their own ways, and they keep using being LGBTI as an excuse to negate persons from society. Oftentimes, overdiagnosis is also a thing where doctors have little or no experience with LGBTI persons, and the keenness to diagnose is most times without an in-depth assessment or even homogeneous diagnosis, a one-size-fits-all approach, which can often place the mental stability in further jeopardy and not providing comprehensive treatment for those individuals. Each individual definitely needs their own assessment, and with proper care, you as mental health professionals can help these persons through whatever challenges or mental illnesses that they're going through. However, with regards to mental health professionals in Barbados, it is oftentimes not the case, where some persons have their own personal biases against the LGBT community and refuse to work with them for many reasons. Again, accessing mental health care can be a bit challenging because of socioeconomic challenges. Some persons don't have the money to pay for the services. Some of the free services are not comprehensive enough to help those persons with anything that they're facing. Sometimes lack of education also impedes the process where persons can identify that they have mental health issues, as well as then subsequently seeking mental health care for themselves. Sometimes, often, family members play a part in the trauma associated with mental health, and they refuse to help the persons in their family to get the services that they need to cope with or to treat the mental health illnesses or diagnoses that they need. However, when it comes to overall, the part of religion also plays a big factor in why LGBTI persons face issues with mental health because of societal norms and religious biases. Persons often think that the Bible is a grounding tool to use against persons of the LGBTI umbrella, where then it places a huge burden on them to fit things within the Christian or whatever faith-based belief system that is a part of their family, and this often causes a split in the person's mental capacity. So LGBTI persons rarely have any access to mental health services. They rarely have access to things or persons that can help them through the periods of mental instability, and we often find them doing things like self-harm. Some of them run to other countries where they think they can be free, and this is not the case. I believe personally that persons need to face the issues that they're going through with the help of friends, family, or their partners. Sometimes the work environment can also cause a problem with LGBTI persons because some persons are LGBTI and they are employed. However, they can't let persons at their workplace know that they are a part of the LGBT community for fear of persecution, for fear of losing their job, and other things which contribute to a fragile state of mind. So when you see persons acting out, you often don't know that they may be a part of the LGBT community. And this is not to paint the LGBT community as bad people, because everyone faces some challenge with mental health stability, mental health illnesses, and people oftentimes don't know how to cope with these things. So with this project, the final outcome is to sensitize the mental health professionals in Barbados, work with psychiatrists, psychologists, work with mental health nurses, work with the psychiatric hospital, work with civil society organizations, non-governmental organizations, to have a standardized care or have standardized ways to work with the LGBT community as it relates to their mental health access, mental health treatments, especially for youth and other persons of the LGBT spectrum. However, it is time for us to stop having the negative stigma associated with mental health, because it's like breathing air. It's something that you have to deal with at some point in your life or another, or you may not experience mental breaks or problems with your mental health, but you may know somebody who is experiencing these things. So be kind, be human, and try to work with people on a human level and not be as judgmental and discriminatory as people often are when it comes to mental health in Barbados and the Eastern Caribbean. We will put in some information from the other Eastern Caribbean countries about the challenges that mental health plays within the LGBT community in those respective countries. And we hope to see you on the next episode, where we talk about more things associated with mental health in Barbados and the Eastern Caribbean. So thank you again for watching, and we'll see you next time with the Butterfly and Equality Justice Alliance.